Howdy, OB-GYN students. Today, Jane, one of our very first GTAs ever at Texas A&M University, and myself, Chelsea Knudsen, will be outlining the expectations for your GTA OSCE. So the first thing that you want to do is wash your hands. And then introduce yourself to the patient. Hello, my name is Chelsea. I'm going to be taking care of you today.
Hi, nice to meet you.
Do you prefer to be called Jane? I saw your name, Jane, on the door.
Yeah, that's fine with me.
Okay, perfect. So after you have found out how your patient would like to be addressed, you can give an overview of the exam to your patient. So today we're going to be doing a breast and pelvic exam. The breast exam is going to consist of me viewing your structure still and in motion. I'll also be giving you some information on breast self-awareness and mammography. And we'll be assessing some lymph tissue, so just making sure that there's nothing swollen abnormally.
Okay.
I'll also be pressing on your breast and making sure that there's no abnormal tissue.
Okay.
The next thing that we'll do is your pelvic exam. That's going to consist of me viewing your outer structures. I'll be viewing your cervix with the use of the speculum, so I'll show you that when we get there. I'll also be inserting 2 fingers to assess some other structures. Any questions before we get started?
No, I think you covered everything.
Okay, did you have opportunity to go to the bathroom?
Yes, I sure did.
Okay, perfect. It's more comfortable if your bladder is empty, and it's actually easier to do the exam too.
Oh, okay.
So, after you've given this overview, the next thing you want to do is introduce the mirror. So some of my patients like to follow along while I perform the exam, so I'm going to be utilizing this mirror so that you can do that. Is that okay with you?
Yeah, that sounds great.
So, I want you to tell me, can you see where you're about the level of your breasts? If
Yeah,
I hold
sure
the mirror
can.
here.
Yeah, that's
Okay,
perfect.
So if you can go ahead and lower your gown to your waist.
Okay.
And I want you to see what I'm seeing so that you know when you go home what to look for.
Okay.
So your breasts look very symmetrical, there's no swelling, everything looks very normal. You don't have to verbalize all of your inspection, but just letting the patient know what you're doing. Alrighty, so Jane, now we're going to do 4 maneuvers. So if you could take your hands at your side and then lift them over your head in a swan dive, exactly, and then back down. Great. And then if you could put your hands on your hips, lean forward and shrug. Excellent. That is also normal. If you'll place your palms together and then press, that activates the muscle. Yes, ma'am. That is perfect. And then I'm going to be looking underneath your breast tissue and assessing for any abnormalities there. If you need something to stabilize you, you can put your arm on mine.
Oh, okay.
Okay. And then you can lean forward. And you can see too, I see some redness beneath your breast. Tell me more about that.
I'm on a new medicine that causes skin dryness.
Okay, gotcha. So this is normal for you.
Yeah, it sure is.
Alrighty, I'm gonna have you go ahead and cover back up.
Okay.
And we're gonna be assessing some lymph nodes. So I'm gonna start at your neck.
Okay.
Make sure there's nothing swollen here. Students, make sure that you have a swollen lymph node right there. Use the pads of your fingers, not your fingertips. Move in a circle, circle, slide technique. Palpations should be overlapping. You see I'm using the pads of 3 fingers. You may need to go down to 2 here because it's a narrow area. Any pain or discomfort, Jane?
No, sure not.
Okay, and then could you shrug? Might be a little uncomfortable. We'll be brief. It's necessary in order to make sure there's nothing swollen there, and there wasn't. If you could lower your gown just a little bit more. Now, the palpation of the supra and infraclavicular, or the infraclavicular lymph nodes could be done while Jane was laying back, or it can be done while she's sitting up. It's up to your preference. All right, Jane, so now for the rest of your exam, if you could just disrobe to one side
Okay.
for the rest of your lymph node exam, then rest your arm in mine.
Okay.
Give me all of your weight there.
Okay.
Yeah, so your muscles are relaxed, and I'm just going to check under your arm.
Okay.
Okay, I'm pressing up into your underarm. I don't feel anything swollen there. I'm not aware of anything swollen. Everything seems normal.
Oh,
you can go
good.
ahead and re-robe.
Thank you.
All right, Jane, for the rest of this exam, you'll need to be laying back. So I'm going to put out the leg extension for your comfort. And then if you could lean back for me and just disrobe to one side.
Okay.
And so at this time, if you haven't already, you could assess the infraclavicular lymph nodes. We've already done that. So Jane, if you could lift one arm above your head, that makes the breast tissue spread evenly against the chest wall, makes it easier for assessment. And then my other hand is going to go in my pocket since I don't need it for Jane's exam. And I'm just going to be pressing on your tissue. Let me know if you have any discomfort or anything like that. I'll press lightly and then a little bit deeper just to make sure there's nothing closer to the chest wall that I'm missing. This assessment should take you 1 to 2 minutes per breast, and we want you to utilize the vertical strike method during your OSCE. At this time, you could decide to go ahead and give information about breast self-awareness and mammography. So I'm going to do that now. Jane, do you do any breast exam at home?
No, I sure don't.
Okay, so breast self-awareness is the thought process that just always aware of what's normal for you in your breast tissue and aware of any changes that happen acutely or all of a sudden. So I'm going to finish examining your breast tissue today, and I'll let you know what's normal for you. That way you're aware if anything changes. And if you notice something that changes, let me know.
Oh, okay.
So everything seems really normal so far. And then mammography, there are different recommendations on mammography. So today you can give the ACOG's recommendation, which is after age 40 annual screening. But do know, Jane, that changes when we recommend mammography. Do you have any history of breast cancer in your family?
You know, I do.
You do? Who has breast cancer?
My paternal aunt.
Okay, so since she doesn't have a first-degree relative, it's not necessary for her to be getting breast exams sooner, but ACOG recommendation is the most aggressive treatment anyway, which would be starting at 40. So after you turn 40, I want you to come in annually.
Oh, okay, from mammography?
Imaging, yes,
Okay.
ma'am. All right, so everything was normal with your breast tissue. You do have some changes here, some ropiness. That seems, is that new or?
That's been normal ever since I had my daughter.
Okay, yes, so that's probably very normal for you. So just be aware if anything changes from there.
Okay.
Okay, so everything seems normal. You can go ahead and re-robe. And that will end the breast exam for you today. So you only have to demonstrate your proficiency on one side of the GTA for the OSCE. Now we're going to move on to the pelvic exam. So Jane, if you go ahead and sit back up, and I'm going to scoop this in here. Please ask the GTA if they prefer a 45-degree or 90-degree angle for your testing. In the clinic, we know we do 45 degrees. With the GTA, for instructional purposes, they often prefer 90 degrees. Jane, what do you prefer?
Let's do 45 today.
Okay. About there?
Perfect. That looks great to me.
Would you like
maybe
a
a little higher?
Perfect. Would you like a pillow?
Yeah, that'd be great.
And sort of.
Thank you.
Cool. Alrighty, so the next thing that you want to do with preparing your patient, you can give an overview of the exam. So Jane, we're going to be doing that pelvic exam now. That's going to consist of me viewing those outer structures. I'll be viewing your cervix with the use of the speculum. I'll show you the speculum when we get there. And then I'll be inserting 2 fingers to make sure all of your structures are normal.
Oh, okay.
Do you have any questions before we get started?
No, I think that's it.
Okay, I'm also now going to pull out the breasts for Jane. And Jane, you can put 1 foot in each footrest. And then if you could move forward until you're aware of the back of my hand against to the side. Excellent. Do be sure that you've checked all of your supplies. For the OSCE today, this just involves a quick inspection of the lubricant being prepared and your speculum open partially so that you can just grab it, and then also having some wipes available for Jane afterwards. Okay. The lamp is also here at the ready. If you need to adjust the lamp during the exam, remember once we touch it, our hands are no longer clean. So the GTA can be your assistant today. If you need help adjusting the lamp, they can do that for you. But go ahead and get it ready beforehand, and if there are adjustments that need to be made during the exam, the GTA can assist. Alrighty, Jane. So one more thing about the mirror. So a lot of my patients like to follow along while I perform the exam, like I told you. So it's just to see what's normal for you. Would you like to follow along?
I'd love to see what's normal for me.
Okay.
How can I hold the mirror to see what's normal for me?
So if you will just hold this at your knee,
Okay.
and I will help you with it and help adjust. You can adjust
Okay.
it, whatever you need, just to be able to see as we go through the exam. Okay. So if you'll move your knees to meet the back of my hands, Excellent. Okay, and I'm gonna sit down here, and I'm gonna adjust this drape, and you can just put that mirror right up here at your knee.
Oh, okay.
Exactly. So are you able to see?
I am.
Okay. And I'm gonna let you hold that.
Okay.
So now we're just inspecting the outer structures at this time. So can you see really well?
Yep, I'm able to see.
Excellent. So I don't see any abnormalities right now. Everything looks very normal, Jane. So the next thing that we're gonna do is you'll be aware of the back of my hand against your thigh.
Okay.
And I'm gonna be moving your structures. Everything looks normal. This is your introitus. This is the opening to the vaginal canal. This is where period or blood, menses, is what we call it in medicine, would exit the body. This is where if you choose to use a tampon, Mary Beth and birth control will be inserted here. If you choose to have heterosexual sex, penis would be inserted to the vagina here. For the purposes of today's exam, this is where we'll be inserting the speculum.
Okay.
And then this is your urethra. This is where urine exits the body. And then this is your clitoris. And I'm going to move up your clitoral hood. That looks healthy. This is where you may experience heightened sexual stimulation. And then your anus. Everything looks normal there. Washing daily with soap and water is recommended, which it seems like you've been doing. Everything looks very
I
normal.
have been. I've also been wiping from front to back.
Good for you. Excellent. Alrighty, so now I'm going to get some lubricant. We'll be inserting one finger. Okay. Be aware of the back of my hand against your thigh. Okay. And now I'm just going to be assessing. Now we're going to assess the Skene's glands first. So lateral, and medial. That looks normal. And any pain with this?
No.
Okay, Bartholin's glands are now normal. I'm going to insert a second finger over the top of the first. I'm going to apply some downward pressure here. Can you bear down like you're having bowel movement? I promise you won't.
Okay.
Yes. And again, very normal. Can you tighten your muscles as if stopping the flow of urine?
Like that?
Yes.
Okay.
And you're about a size medium speculum today, so you'll be aware of the back of my hand. And you can go ahead and cover back up for
Okay.
now. I'm going to get my supplies ready for the speculum exam.
All right.
So go ahead and check the surfaces of the speculum for any kind of rough edges. If you find one, throw that one away and get a new one. And you can turn the light on now if you would like. So Jane, this is the speculum. These are the bills. These are the handles. The bills are the only portion that are going to be inserted.
Oh, okay.
And then we'll be able to see your cervix, which is the opening to your uterus, which is where baby grows and all those kind of things.
Oh, okay.
So we're just making sure that everything's healthy. Cervical cancer is the main thing that we're looking for there.
Okay.
And I would take swabs at that time as well.
Okay.
We will not be doing swabs in your OSCE. You'll be aware of the back of my hand against your thigh.
All right.
And I'm just making sure I know where I'm going. Excellent. Let me know if you have any discomfort. Shouldn't be uncomfortable at all. Okay. Making the bills parallel with the floor. And you may hear a click here, Jane. Alrighty. And if you'd like to verify my placement, Jane.
Yep. That's my cervix.
Your cervix looks very healthy. And this is when I would take the swabs, like I said before.
Okay.
Now to remove the speculum, I will be uninserting the speculum just until I see the cervix hop off the bills, which I see that now. And now I'm going to be pressing up and allowing the lock to break. And now I'm just going to let the bills close on their own. Okay, perfect. That's very normal, Jane. Now I'm going to be doing your bimanual exam. So this involves insertion of one finger and then a second finger. So you'll be aware of the back of my hand against your thigh. And I'm going to be inserting one finger and a second. Okay, and I'm going to stand up here, and yes, okay. So I have my fingers on your cervix. I'm just making sure there's no masses,
Okay.
and there's not anything that is concerning.
All right.
Everything is normal.
Okay.
So now I am going to be seeing how large your uterus is, making sure
Okay.
it's normal size. So if you have lubricant on your hand, you can cover the patient if she prefers, as long as you know where her umbilicus is. So I'm going to go ahead and cover her since I know where it is. I don't want to get lube on her abdomen.
Okay.
Alrighty, Jane. So any discomfort?
No. It's a little tender, but not bad.
Oh, I'm sorry. Is this okay?
Pretty
Is that
normal.
better?
Yeah, that's fine.
Okay, good. How long has the tenderness been going on?
Oh, I'd say, I mean, that's just normal for me.
Oh.
Just not major tenderness.
Oh,
Nothing.
okay.
Nothing concerning.
Okay. Okay, good. I'm just making sure when it starts and stops rocking Okay, it's a little bit smaller than the size of my fist, so that's
Okay.
normal.
Oh, good.
Okay, the next thing I'm going to do is assess an ovary, and you only have to demonstrate proficiency with one side. So I'm going to be putting my fingers in the fornix, and then I'm going to move her drape up so that you can see. I think I'll see that, I don't know. And I'm just going to be swiping to catch an ovary. There we go. Okay, and I don't feel anything. Do you have any pain or tenderness?
No, that's fine.
Everything seems normal then. So
Okay.
go ahead and cover back up.
Great.
So now you can do your session conclusion. Jane, there are some wipes here, some wet wipes, and then just dry tissues as well if you prefer.
Oh, great.
You are on the edge of the table, so make sure you push back before you sit up.
Okay.
And I'm gonna let you go ahead and get redressed, and we can discuss follow-up and those kind of things, but everything was very normal today.
Okay, good.
So, wonderful, normal exam, so I probably just want to see you again in another year just for your well-known exam.
Okay, great.
Do you have any questions, comments, or concerns?
No, I think that's everything.
Okay, I'll let you get dressed and then we can talk further.
Okay,
Thanks.
great.